Hello, my name is Ryan Spiker, and I am pursuing my Bachelor's of Science in Nursing at West Coast University in Ontario, California. I am currently enrolled in Epidemiology. For this course, we have been assigned the task of reviewing a research article in regards to public health and epidemiology. The assignment allows us to review the information presented in a given article and discuss our findings. The article I have chosen to present today is Epidemiology of Sexually Transmitted Infections Among Offenders Following Arrest or Incarceration. The research is presented by Sarah Y., Mark Rosman, and Matthew Alsama, along with other members of the American Journal of Public Health. The article looks at the incidence of sexually transmitted infections contracted by those who are recently arrested, currently serving time, or are 1 year post-incarceration. Adults and juveniles entering correctional facilities have high rates of sexually transmitted diseases including chlamydia, gonorrhea, syphilis, and HIV. However, limited STI and HIV screenings and testing services in jails and prisons make estimating the overall prevalence of STIs and HIV difficult. Despite extensive research in documenting high rates of STI and HIV among individuals who have interacted with the justice system, there are few data on STI and HIV rates in the period following the incarceration or following arrest. I chose this particular topic because my father works for the California Department of Corrections and Rehabilitation, and I also envision the CDCR being a prospective employer of mine. So an increased incidence of STI infections among those incarcerated will be of much concern. The information contained within this article referred to the medical records of those individuals who fit the criteria for the research. We conducted a retrospective cohort study of adults and juveniles with an interaction with the justice system in the Marion County, Indiana, including arrests, jail, prison, and juvenile detention facilities. Collectively, we will refer to these individuals as offenders. To assess the test positivity, STIs, and the incidence of HIV in the 1 year period after arrest or incarceration, we included data on positive STI and HIV tests between January 1st of 2000 and May 14th of 2009. Data on arrest, juvenile detention, and juvenile or adult prison from January 1st, 2000 to May 14, 2008. And data on jail from July 1st, 2003 to May 14th, 2008. This quantitative study that objectively looks at the number of those infected with sexually transmitted infections after an arrest and 1 year following incarceration. Rates of STI and incidence of HIV in the 1 year following arrest or incarceration were higher than that of non-offenders, but rates varied by demographic characteristics and types of detention facility. Rates were the highest for chlamydia, which were 2,968 per 100,000 cases, and for gonorrhea, 2,305 for every 100,000, and the lower for syphilis, which came in at 278 for 100,000 cases, and HIV, 61 for 100,000 cases. The highest rates for an incidence of HIV were among the individuals aged 20 to 44 years of age. Individuals incarcerated in juvenile detention and juvenile prison facilities had higher rates of chlamydia and gonorrhea in the post-incarceration period than that of individuals from adult correctional facilities. It is not surprising that results of the study differed between varying demographics and types of detention facilities because a minimum security facility may allow for more personal contact and increase the incidence of the disease. The study results demonstrate correlation between incarceration and increased incidence of STI and HIV infection, especially following 1 year post-arrest. The information contained within the article was very interesting and applicable to real life as well as a career in future nursing. The results of the article were clear and concise and were broken down effectively by type of STI along with the demographic and other key factors. Individuals who were recently arrested or released from incarceration had high rates and tested positively for STI and the incidence of HIV. Demographic factors associated with increased STIs and HIV risk were similar among offenders and non-offenders in Marin County. Although the article did not have access to sexual behavior data, evidence suggests that individuals practice high-risk sexual behavior after release that put them at greater risk for STI and HIV. I believe the article demonstrated a significant strength, especially when evaluating all interactions with the justice system, including arrest, jail, prison, and juvenile detention. After reviewing this article, I now have a better understanding of just how much this problem is and the spread incidence of sexually transmitted infections is within the justice system. As a future nurse, I would express concern all individuals pursuing a career within the justice system. Standard precautions and appropriate personal protective equipment should remain a priority when dealing with the possibility of encountering a communicable disease in this setting.